You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. 1 year ago today, folks, was the day the World Health Organization declared COVID-19 a pandemic. Cases were rising in the United States, and Donald Trump could no longer say that the virus would magically disappear. At that time, there were roughly 1,200 cases in the United States, and 40 people had died. A year later, almost 30 million known infections have taken place, and 526,000 people have died in the United States alone. A whole lot has changed. Everything has changed. Our school, virtual. Our meetings, office buildings have emptied. Restaurants have shut down. Travel has halted in many places. Although some states are opening up, we've still seen a massive amount of change, not only in this country, but also across the world. Have we learned anything? Joining me now is Dr. Kimberly Butler Willis. She's the Director of Community Health at Roper St. Francis Healthcare in Charleston, South Carolina, and also Managing Director of Goodstock Consulting. Certainly glad to have you with us, Dr. Butler Willis. It is amazing to think about a year ago how, and for me, in fact, it's crazy. My last trip was in South Carolina. I was in Charleston. I was there for the primary, and we started hearing about these things. And all of a sudden, March hits, and then it was really when sports leagues, when the NBA shut it down. That is when the whole country went, "What the hell?" Because when you start shutting sports down, you know stuff has gotten serious in America.
That's right. That's right. And unfortunately, it took sports shutting down for the general population to really understand what we were under. Those of us that work in healthcare, we knew that we were under attack, and we were doing our best to make sure that we got that message out to the general community. But it took us having some inconveniences and even some sacrifices in order for people to really wake up. But then again, we were under a federal administration that was not properly warning the community as well. So I can't really blame us so much, especially when our leaders weren't giving us the right direction.
There were so many things that we were told then. We had a massive mask shortage. We were told not to wear masks, primarily because they wanted to keep it for emergency workers. We didn't know exactly, and again, what was happening, who was impacted, what do we do? Do we stay indoors? Do we go outside? I mean, all those different things were happening. There are a lot of people who have been highly critical of doctors. But the reality is, we hadn't seen anything like this in the United States to that degree in 100 years since the Spanish flu. So for me, I gave medical professionals a huge pass because while we were trying to figure out, y'all were trying to figure out what the hell was going on.
Absolutely. And not only were we trying to figure out what was going on, but we were trying to save lives while we're trying to figure out what's going on, because it's not like since COVID came to the hospital, we stopped receiving our stroke patients, our heart attack patients, our asthmatic children. So we were still dealing with so many other chronic conditions that America is already known for, on top of this very mysterious virus that we thought was respiratory, comes to find out it actually infects your blood. So it could attack any function, any organ in your body, and it was so elusive that we didn't even have time to figure it out. We were essentially building a plane while we were flying it, and we all know how dangerous that could
be. Here we are. A year later, there's so much that we have learned. What, though, is your greatest frustration that you still see in the country when it comes to COVID-19?
Health disparities. So we could do such a better job with focusing on those social determinants of health. I have a PhD in public health, so not to be confused with a medical doctor at all. But it's really, COVID has given us public health folks an opportunity to really sound the alarm and say, this is what we've been saying all along. It's not just about treating conditions, but it's about treating the full patient. In fact, I heard a doctor say, I called a patient non-compliant when in fact the patient was illiterate. So we have to start to consider the social dynamics in which the social context and social environments and physical environments in which our patients live if we truly want to start talking about prevention and full wellness in healthcare.
We are right now in the midst of the vaccine, and you have folks like Governor Larry Hogan of Maryland and others who are saying that African Americans don't want to take the vaccine. I'll talk to Dr. Ebony Hilton about this. I've been talking to others. They say no, that's not the issue. Black folks they don't. It's a matter of the information, where to go, how to sign up. I mean, how to even access it. Is that what you're also seeing?
Exactly, Roland. And I am so tired of hearing healthcare institutions spout that kind of lie. That allows us to take the responsibility off ourselves to get the vaccine to those people. So it's not that African Americans do not want the vaccine, it's that they want to be informed about the vaccine. They want to be empowered about the vaccine. And the best way that we can do that is to make sure that we give them all of the information possible so that they can make the best healthcare decisions for themselves and their families. So stop saying that. We want the vaccine. In fact, we want you to bring it to our back doors, but we also need you to come and talk to us about it and make sure that we feel educated about this decision and this choice and not forced into this new vaccine that we just came up with. Because that's how it feels. We have a generational history of mistrust in healthcare. And it's about time that healthcare organizations, including my own, we have to acknowledge that. And we have to go into these communities with a humble face, verbally saying that we know what we've done in the past, but this is our shot, no pun intended, to get it right.
We talk about where we are with the vaccine. Johnson & Johnson, their vaccine is coming online. You have Moderna, you have Pfizer. I get this question a lot. I've even asked the question. In fact, I texted Dr. Hilton last night. And I hear people who are like, look, I'd rather have Moderna. I'd rather have Pfizer. I'd rather have Johnson & Johnson's one shot. I'd rather have that. Walk folks through the three different shots. Is there really any big difference?
So the largest difference, I would say, so Pfizer and Moderna are more alike. They're the two doses. They have the highest efficacy levels. Johnson & Johnson's a little lower on the efficacy. There's only one shot, but it still will keep you out of the hospital and out of the graveyard. And that's really what we're trying to do right now. We want to stop the bleeding. So either of these vaccines are potent, they are reliable, and they will keep you from dying. And that's really all that we need to do. And I suspect that in the future, we'll revolutionize this vaccine. We'll get better at it, much like we've done with the flu shot. And so there may be something new to present to the population next year, especially as these variants are coming out. But just so that you know, all three vaccines are safe. All three will keep you out of the hospital. All three will keep you out of the grave. It's really up to you to decide which one would be best for you.
We have states that are opening up, Texas, Mississippi, and others. It has to be greatly frustrating to see folks lifting mask mandates and saying 100% completely open.
It's insulting, actually. It's not just insulting to healthcare workers, but it's insulting to those families who have lost loved ones. We know that we're not there yet. We are just at, about 19% of the population has been vaccinated. We have to get to 75% in order to reach herd immunity. And so if we have states like Mississippi and Texas, one of the largest states in the United States, opening the floodgates again, it's only going to take us back. And I'm not sure why these governors don't understand that. We're so close to the finish line. We're so close to getting back to those football games. We're so close to getting back to church services. We're so close to getting back to grandma's house for dinner. But we can't get there if we're not all in.
All right, then. I want to bring my panel in right now. Of course, every Thursday, we have Dr. Greg Carr, Chair of the Department of Afro-American Studies, Howard University, Reese Colbert, Black Women Views, Erica Savage Wilson, Savage Politics Podcast. All three of you, I'll start with you, Erica. A year ago, early on, we had folks on from your home city of Albany, where many, there was a funeral that took place there, and COVID spread like wildfire. The morgue was filling up of folks dying, and folks were absolutely scared to death of how widespread this thing could be. There we go. Think you're on mute.
There we go.
There you go.
That mute her. Yeah, that helps. But yeah, it's hard to believe that that was a year ago. And shortly after you provided that coverage, Roland, I believe a week later, my dear friend, Femi Anderson, um, went on. She transitioned after she was rushed to Emory to try to be, it's still hard to talk about, but to try to save her life. And the best efforts that were provided just weren't enough. And that was really the beginning of a now 500 and almost 30,000 people grieving process that we have collectively endured as a country. And then speaking to Albany, and now we're seeing microcosms of Albany that have popped up all around this nation that now, hopefully with age restrictions, the CDC reconsidering that those folks who are suffering the most, which would be Black and folks of color, 40% of Black and people of color work in service industries, hoping that they would be fully vaccinated. We're still, seeing issues in that area. And so a year later, here we are still fighting the good fight, still burying people. But what is new that's on the horizon, as you spoke with our initial guest, was we now have 3 vaccines. And so as people begin to understand what these vaccines mean, not only for them, but for the community and really for the world at large, it is really my hope that people will continue to engage Roland Martin Unfiltered to get the latest on what's unfolding with COVID, but also to do their own research on vaccinations and make their vaccination plan. Or if there still is, folks are still not really confident around the vaccine, that they do talk to somebody that they do trust within the medical, the public health community to help them to understand what it would mean to get a vaccine. It's not just a vaccine for us, it is essentially a vaccine for our entire collective. So it's hard to believe also that the last time I think we were all in studio together was March 3rd. It was after Super Tuesday coverage. So a lot has shifted, a lot has changed, but we still have an incredible water fight. And it is just really my hope that people do explore any opportunity to be vaccinated and make the best decision that they can, not only for themselves, but for the community around them.
To that point, Dr. Butler Willis, that we're already hearing this right now, where the CDC is recommending that if folks have gotten vaccinated, they can get together in small groups. I know some other folks who are saying they still don't want to do that with their grandparents because people want to see their grandparents. They want to see their parents. My parents are both 73, but there's so many people who still are so afraid that something could happen. They're like, no. I want to give this a little more time that we have sort of this a much longer stretch of things going well before I take that chance.
Absolutely, Roland. And I would advise the same. This is still a very novel virus. And thankfully, we have these vaccine options, but we're not exactly sure if you can still transmit COVID. So although you're protected, can you still transmit it if you contract it? We don't know that yet. And so we do encourage people, although vaccinated, still wear your mask, still wash your hands, still socially distance, still just be as safe as you would if you weren't vaccinated, because there are still too many unknowns.
Reese, for you, it's interesting. You're expecting. I was supposed to do. I remember last year. One of the greatest concerns people had were for women who were pregnant. The impact. There were doctors who were choosing not to go home because they did not want to infect their children and their spouses. They were sleeping in cars. There were athletes who were freaking out, who began to opt out by saying, "Look, my wife is a newborn kid. I'm not chancing this whole deal as well." And it was amazing to watch really how this country, we were completely freaking out because folks simply had no idea how lethal this was, especially when I remember the stories of the bus driver in Detroit where somebody coughed on the bus and literally within a week, he's dead.
Mm-hmm. Yeah, I mean, being pregnant during this pandemic has definitely made it the longest 9 months of my entire life. But it's so it's just really, really isolating to be pregnant in a pandemic. You know, my husband hasn't been able to see any ultrasounds. You know, aside from being in the emergency room, he has to wait in the car or wait at home. And, you know, the one thing my doctor said over and over again is don't get COVID, you know. So I've been isolating, you know, this entire quarantine, but particularly as a pregnant woman. And the pandemic isn't over for me. For me, it's scary to see things like states opening back up. But when I go to the doctor, I still have to have on a KN95 mask. I'm going to have to deliver a baby with the mask on. I can only have my husband with me in the hospital. I can't have any visitors. And so the pandemic is still very much a real thing for people like me. I can't get vaccinated yet, or it's not known what impact it will have on pregnant women. Luckily for me, my husband has been vaccinated. My mother-in-law and my mom have both been vaccinated. So that does open up some doors for at least me to feel a little bit more comfortable. But yeah, being pregnant in a pandemic, it sounds all good because you're not missing out on anything, but it's very, very, very much just an isolating and completely different experience than anybody could ever imagine.
Dr. Greg Carr, you've had to do what a whole bunch of teachers and professors have done, trying to educate students online in a whole different environment, totally different than having lectures in the classroom. How has this adjustment the last year been for you, your students, faculty, and staff at Howard University?
Well, I can say this, Roland. I think as Senator Raphael Warnock said on your program last year, COVID-19 exposed COVID-16-19. And so all the structural inequalities we have been brought to bear. And I've been in nonstop conversation with educators, K-12 especially. You've got young people who simply in trying to manage getting from day to day have disappeared from online education, have disappeared from school. We won't know the implications of this for quite some time. For me, this moment has rejuvenated me in some ways because it jailbroke the structural problems that we often face in under-resourced places like historically Black colleges. Many of my colleagues are trapped in the white nationalist-controlled states in the South, which is where most of our 105 HBCUs are, and have been forced back into the classroom because some of those schools need the revenue, and the states, whether it be South Carolina, whether it be Georgia or Texas, have demanded that they go back to campus, particularly the state schools. That has created an emotional tsunami. This has brought out, and for me, it's not only easy to manage as an individual, it's actually allowed me to engage in work beyond the physical classroom. And as we know, disasters, traumas, accelerate trends. This is where we were headed. And now, so I'll end with this in a moment. Everyone is going to do more of who they are and what they were doing before this thing hit. So whether it be Moderna, Pfizer, Johnson & Johnson, I expect, Naomi Klein calls it disaster capitalism. There will be, as Dr. Butler Willis has said, there are going to be more vaccines. They're going to make windfalls of profits. A lot of it's going to come from our tax dollars. And I appreciate you, Doc, saying it's going to keep us from dying and keep us from being sick. And as we know, we don't know the long-term impacts because there hasn't been any long-term impact. But that same thing is true for teachers. Teachers are coming up with different ways of teaching and learning that aren't reliant on huge infusions of resources. So when this is over, education is going to be transformed, whether we want it or not. And the best thinking is what we will have to apply to the problem of how do we now build a system where there wasn't one before? Because believe it or not, there was no efficient system of education in this country, and this is what this pandemic has exposed.
To that particular point there, Dr. Willis, there were a lot of people. When I think about, we had a 50 CAN as Education Reform Group on the board of directors. We actually share offices with them here, Roland Martin Unfiltered. We had a board call today, and I made this point that there were a lot of people who could not stand distance learning. They could not stand online. They didn't like people working from home. They said it couldn't work. Then, of course, a year ago, we had no choice. There were those who were saying, "Oh, we'll be back in school in the fall," and I kept saying, "No, we're not." And I remember in April and May, I kept telling people, "Hey, y'all, it's going to be October 2021 at the earliest. I said, frankly, it's going to be more like 2022. People are like, oh, man, you got to be crazy. I'm like, okay, all right. Y'all go right ahead. Keep thinking that things are going to be that way. Churches, so many churches, especially a lot of black churches, they couldn't stand off. Don't come in with that Facebook, YouTube stuff. All of a sudden, I was getting calls from pastors all around the country. I was doing webinars, trying to teach folks all of a sudden on the fly. We are forever changed. And I'm telling you right now, people keep saying, when can we get back to where it used to be? That ain't happening. I think going to offices has changed. I think all the stuff that we touched has changed. I believe education is going to be forever changed. Elementary school, middle school, high school, college. I think same thing. Look, pastors have already said you can forget building large churches. Many of them are now realizing that they may not get members coming back. Folks may want to continue doing what we always call bedside Baptist on Sunday. And so I just think that people need to realize that the way of life we had pre-COVID is not going to return once everybody in this country has been vaccinated, even a year or 2 years from now.
It is forever changed. We cannot put the toothpaste back in the tube at this point, right? And so I love what Dr. Gregg mentioned, because this is really our time, especially Black and brown people, to fight for what we know we deserve, because the system is broken. It is down. It is weak. This is the time to stand up and to advocate for your rights, because companies are listening. Healthcare systems are listening, because they don't want to be called a racist. And so use that to your advantage. You said, Dr. Gregg, people are going to continue being exactly who they are. In fact, I'm going to add an exclamation point to it. You're going to continue to be exactly who you were before COVID, but use this to your advantage. Because if companies are going to start to say and put out all these messages about how equitable they want to be and how they're recognizing you Black and brown folks, and let's celebrate Black History 365, hold their feet to the fire. Make sure that they do just that. Find your voice as the consumer, as a primary and priority consumer in America, and demand what you deserve. And that's that's agnostic of industry, honestly. And Reese, I want to give you a shout out, girl, because you look amazing. And being pregnant during this pandemic, you look amazing.
I'm ready to pop.
Yes, you are popping tonight. You are popping tonight.
So she the only one looking amazing? Look. Erica, Greg over there with Greg with the clean dashiki in the books. I'm still like ain't nobody else here.
I just had to give her props, because I didn't even know she was pregnant. She's so poised and graceful, and she looks so beautiful. But we do have to get back to a society. My children have to go back to school. They have to, or I'm going to crack. They have to, because I know that as Black and brown children, they need opportunity and access to every resource possible for them, because this world wasn't designed for them to succeed. And think about it. My children come from a 2-parent household where we can afford to get you a tutor and get you additional resources. But what about those children who have to go to McDonald's just to use the internet? What about my other rural folks who struggle with internet access, or even opportunities in education, and their parents even being at home to help them with homework, because they still have to work, putting themselves at danger for the disease, and then coming right back. So it's just so many social determinants that we have to consider, and education, I believe, is honestly foundational. And I was confused as to why teachers weren't even considered in phase 1A.
One of the things that President Biden is going to say tonight is going to call on states to open up COVID vaccine to everyone. So get rid of all these different categories. Doc, speak on that, because again, folks don't know, well, what category am I in? Is it by age? Who is it impacting? But also, are we at the point now where it's actually now widely available? I had Tom Joyner on last night, and he said, I don't understand why we're not giving COVID vaccine 24 hours a day.
Right.
Why aren't we? Because the system wasn't designed for us. If in phase 1A, we focused on healthcare workers and long-term facilities. We know that our people don't go to long-term facilities. 70% of long-term facilities are white people. Healthcare workers, predominantly white people. And so now that we're in South Carolina, at least, we're in phase 1B, where we've opened that up, and now it feels more like the general population. But we still have to make sure that we are allocating resources equitably. If we know that Black and brown people are dying at higher rates from COVID, we need to hyper focus on those areas and making sure that we're going to those minority communities, those rural communities, the uninsured folks, because that just makes the most sense. We can't give everyone the same thing because everyone doesn't need the same thing right now. I can't go into the hospital limping. I can't go into the hospital with a sore throat and you give me crutches. That makes absolutely no sense. And so I feel like that's what we've done with this vaccine. We gave America crutches when we saw that the sore throat was honestly our African American and Latino and indigenous populations. And we failed on that part. But I pray to God that with the release of Johnson & Johnson, we can see more opportunities for people in those priority populations to be vaccinated. The one dose really helps with our more transient folks, especially like our homeless people, are those that you may not be able to find again for a second dose.
Mm-hmm.
Yeah.
Well, it has certainly been a whole lot that has been going on, and we still have a long ways to go. We've lost more than 500,000 people. Black folks have been impacted in such a credible way, but we also are glad to see people who have stuck together, been far more resilient, have been helping one another. And I will say this here, I think, once we reach the point where we truly can open up, I think there are a lot of people who are going to greatly value being able to get together and just to be able to say hey and hang out with somebody. So I think this country might get a little crazy. I think a lot of work may not. It's the weirdest thing. I think when this thing opens up, I think a lot of work may not happen because for a lot of people who put things off, it's going to be a whole lot of being outdoors, partying. It's going to be like in Miami, they don't like there's no such thing as really shutting down. That might be everybody else. And so it's going to be real interesting to see again how folks respond. So Doc, we certainly appreciate your leadership. Thank you so very much. The folks at Goodstock, Dr. Kimberly Butler Willis, thanks a lot.
Thank you guys so much for having me, and congrats to all of you. Thanks for your leadership as well.
I appreciate it. Thank you so very much. All right, folks, back to our Roland Martin Unfiltered video in just one moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends, go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have that you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.